Surgical options for scoliosis are typically considered once curves hit this something called the severe range. Now, the severe range could be misleading to patients because if they hear the word severe, they sometimes can associate severe effects. Unfortunately, patients could have severe scoliosis and no pain, no discomfort, no outward symptom other than asymmetry or posture misalignment. Other patients could have severe scoliosis and have severe pain. So there's no real direct relationship to size of curve and pain. Unfortunately, though, as curves get bigger, they're more likely to lead to more complicated effects, but we really don't know. So when should surgery be considered? Well, surgery is typically considered once curves break this 40 to 50 degree range, and there's a little bit of a gray area depending on where the curve is located and how old the patient and, of course, the risk of progression. That's when it's typically considered because at that point they consider bracing ineffective, and therefore that's when they consider it. However, I'm suggesting that curves probably should be not considered for surgery until they hit about 60 plus degrees. And the reason why, because there's evidence now, especially in improvements in conservative treatment, that curves can be reduced and they can be reduced below a surgical threshold. So therefore, if we think at 50 degree being the surgical threshold, if we see a curve at 60 and reduce below 50, we can avoid surgery. So therefore, I think really when curves should be started considering surgery is when they break 60.